Hello, and thank you for joining me today. I am pleased to present our poster titled Novel Correlations Between Exhaled Breath, VOCs, and Lung Function in Ultramarathon Runners, Insights from the 2019 Ultra Trial du Mont Blanc. Ultramarathon running causes significant physiological stress, particularly to the lungs and metabolic systems. While blood-based biomarkers are commonly used to monitor these effects, repeated blood sampling can be invasive, uncomfortable, and difficult to carry out in the field. Exhaled breath, which contains volatile organic compounds, known as VOCs, offers a non-invasive alternative for assessing systemic, metabolic, and physiological responses. Previous studies have shown that VOC profiles in exhaled breath change after ultramarathon events, highlighting their potential as markers of exercise-induced stress and adaptation. This study examined how breath VOCs are associated with changes in lung function in a group of elite athletes participating in the 2019 UTMB. 32 healthy participants were assessed before and after the race, with testing performed 24 to 72 hours before the event and again with 1 to 4 hours after finishing. Assessments included blood sampling, spirometry, exhaled nitric oxide, transthoracic ultrasound, and submaximal cycling. Breath VOCs were collected using Alson Medical Receiver device, part of the breath biopsy platform. This system uses Casper to deliver clean, VOC-free air, and the receiver selectively captures the metabolically relevant alveolar breath fraction using pressure tracing and dual pump control. A total of 48 breath samples from 24 subjects were analyzed before and after the race without fasting requirements. Post-race data showed a modest decline in lung function, including reduction in vital capacity, FEV1 and MEP, findings that align with the expected impact of exhaustive endurance activity. More notably, stronger associations among respiratory measures were observed after the race. For instance, MEP showed tighter correlations with spirometric parameters like FVC and FEV1, suggesting that respiratory muscle strength and lung function become more closely connected under physical stress. The VOC analysis revealed 63 compounds that changed significantly between pre- and post-race samples. Among these, 2,3-butanediol, a compound produced by gut microbiota, increased markedly after the race and exhibited stronger positive correlations with lung function, specifically with vital capacity and FEV1, but only in the post-race samples. As a product of anaerobic glucose fermentation by gut microbes, the emerging link of 2,3-butanediol to respiratory measures may reflect increased gut-lung axis activity, potentially due to altered gut permeability or shifts in microbial metabolism. This study is the first to show correlations between exhaled breath VOCs and clinical respiratory variables in the context of ultramarathon running. Overall, the findings highlight the potential of breath analysis to serve as a non-invasive tool for monitoring physiological responses to extreme endurance exercises, with emerging links to microbial metabolism as well. Thank you for your attention.